competent facilitator who's going to help us to synthesize the information that we have already heard so far today, and most importantly, to help us to begin the discussion and to begin thinking about the role that each of us has in improving the lives of youth who are transitioning out of foster care. Mr. Arande Miller, the Senior Associate at the Center for the Study of Social Policy in Washington, D.C. Prior to this role, he has served as the Chief of Staff at the Maryland Department of Human Resources. He was formerly the Senior Director of Strategic Consulting at Casey Family Programs, where he was responsible for providing consultation and support to the state and local public child welfare systems throughout the United States. And I think most importantly for us today, he is also a former foster youth who was adopted through the foster care system. So thank you very much, Mr. Miller.
Thank you, thank you, thank you. Hello. I see some familiar faces. Hello again. I first want to say that it really is an honor and a privilege to be here. And so I'm not here to speak, so I'm not gonna begin down that road. But what I will say is that it's an honor and a privilege because this is home for me. So Prince George's County is home. I've lived in Prince George's County for most of the 24 years that I've been in this area. So I came here from Detroit to go to school at Howard. And so for most of the time that I've been here, I've actually lived here. And so I've had the honor and privilege to be involved in what I would call systems reform, systems transformation work, mostly focused on the foster care system for the last 15 plus or minus years. And so, but it really, really is exciting to see the work that's happening here in Prince George's County. So I had a small opportunity to support some of the work in Prince George's County when I was at DHR. And so I know the leadership here in Prince George's County, so we heard what the outcomes are. We've heard about the improvements, but we know that there's still work that has to be done. But you really, really need to know that if you look at Prince George's County within the larger state context, but especially within the larger national context, you know, aside from the fact that we're clear about the work that remains, but the kind of work that's happening across each of the different branches of government, especially here in Prince George's County, this, I think, is a model that people need to know about, certainly throughout the state, but also in other parts of the country. And so it really is an honor to be here with you today to support some of this process. So what we actually want to do is to open up the room for a little bit more conversation and reactions to the reflections that you heard about the progress to date, some of the recommendations that have been made for moving forward. And so we want to open this up. And so, I'm looking around the room, but I also want to make sure that we are clear that this is also opening up for reflections from some of the youth who are in foster care as well. And so just to get started, I just ask initially, what was most striking to you in terms of what you heard in the presentation?
I'll start. The conversation about mental health and the great need for better integration. I was telling Marshall, one of the things that we really need to think about is what we call it. If we already know it's stigmatized, why do we keep calling it mental health services? I have a mother who I often ask her if she's had her time on the couch, because I tell her that we all need an opportunity to talk to somebody about some of the things that are going on in our lives. Because if I use the word mental health with her, I will get cursed out. So I have to change my language with her so that she's receptive to the conversation, and more importantly, so that she seeks, that her time on the couch and seeks that opportunity. And sometimes I'm that person, that sounding board, but I give her that opportunity to do that. And I think we have to be kind of deliberate about the terminology. And I really would like to hear from the young people about what the opposition is, because we've talked to our kids, and we know that nationally, children in foster care are over-medicated. We know this. We know this is an issue, and I think that carries forward as they get older and get the opportunity to make those decisions themselves, they remember that medication, that trauma from that, because it has all kinds of side effects. And that's kind of the pushback that we're getting. So, I would love to hear from you all, my young people in foster care, about why you think we have the data around mental health and the underusage of mental health services.
All right, thank you, thank you, thank you. So the language that we use, other things that are really striking that people heard or saw.
I would just like to follow up on what Gloria has just said. I think one of the problems with our youth is that we are labeling them as mentally ill. We are giving them diagnoses rather than talking with them about the consequences of the trauma that they've been through. And I think that we are over-diagnosing kids in foster care with mental illness rather than really looking at what has happened in their lives to bring them to the point they are. And so if we could begin to talking about what's happened to you in your life rather than immediately talking about medication or more medication or more medication, and starting really in Prince George's County, we've begun that conversation and begun that request for services to deal with trauma. And so I think we need to stop labeling our youth in foster care as mentally ill and really looking at where they are now and what has brought them to that point.
All right, thank you, please.
So I was very horrified by the school statistics, and I know that everybody talks about how important it is that people get their education, and that's what's going to hold foster youth, pull foster youth through into real emancipation and self-sufficiency. And I really wanted to know from the foster youth that we have here what they saw as their challenges going through school, because I know what we have in our statistics and what is recognized through studies, but I don't know how individually you feel that school was made easier or more difficult for you while you were in foster care, and how that's affected your choices in terms of what you want to do with your education.
All right, thank you. So we've had at least a couple questions that have been raised, and hopefully we'll have some young folks that can respond. And so please.
We do, and I just want to ask Alexis, because yesterday or the other day at the Youth Advisory Board, you did a wonderful job, and I'm going to stand next to you because I really want you to speak about the campaign in terms of the language that we talked about and the word foster. That was something that was really, really brought to our attention, and how the negative connotation just around the word fostering. And so what they've decided to do was do a rebranding, a marketing campaign to say, what else can we call ourselves? We're youth in care, but the word foster in and of itself, when we go to school and we're identified and we're known as foster kids, kids look at us strangely in a different way. And so what we charge them with is to say, you know what, let's look at a new marketing and roll out a new campaign and say, what is it that you feel? What is it that you want to be? Yes, you're children. Yes, you're human. But when you're a part of our family, how do you want to be identified? So if Alexis is not going to be brave enough, Miss Haley is with her, perhaps we can get Mickey. Alexis, you're not ready? Mickey? You can do it.
Hello, everybody. Yes, we have a meeting on, I'm a vice president of Youth Advisory Board in Prince George's County, and we have a meeting on Wednesday with Miss Stacy. We discuss about what's the issue we experience in foster care. So we brought up foster care home, ourselves, like what experience we experience, because you can walk with us. You can just come see us every single day, but you're not home with us. Like, I think living home is the most important thing, not visit. for us in foster care. So we discuss about foster home first. We brought up on foster home and our social worker, how we can see our social worker often, because we all get once a month, but we feel like it's not enough for us. Like, it's not enough for us. Like, something, if you have an emergency during the night, you know we can use the urgency number, but we not get in contact with the cell phone for our social worker. Like, if we have an emergency midnight, like, for example, something going on, like your foster parents don't want you anymore, like, say, you got to get out of my house right now. I see that, like, some of my foster sister, I call all everybody my foster sister. I see that, like, say, you got to get out of my house tonight, like, when I give you a few minutes. So what's the kid go do? Like, who you go call, who you go contact, like, that point, like, midnight. Like, some kids don't have a job, they don't have a cell phone. How can you contact your social worker? For the work of foster, it's just like painful. If you go somewhere, say, who you live in? Oh, that's my foster mom. We don't like the word foster. We say, like, can we use like at least kids in care without foster care, without kids in foster care? Can we change that a little bit? Please.
Yeah, thank you, thank you, thank you. So there were at least two big points in there. One is that an acknowledgement that they interact with the social workers more than the once required per month. And what I'm curious about is, do you find that you need that more as you get older, that you need more of that contact, more of that interaction? Okay. And so...
I'm 18, so that's my first year in college. It's been tough for me. And like she said, I can answer your question about the school you ask. For the education, I feel like you have to help yourself, for real. Like I don't experience when I'm in high school. But my first year in college, I feel like for yesterday, I just passed my math. I feel like, thank God. If I don't do for myself, I'm not going to pass it. Nobody there to help me. You have to help yourself. If you say you want to go for it, go for it. Like, work hard and pay off. Like I told my social worker this morning, I said, I passed my math class because nobody helped. I said, I'm going to pass it. I don't want to fail my math. And I have Alexi with me. You have the same math. So every time we just discuss, after I finish work, I have to go back to school, like finish school. I don't have a night class, but I'm going to go back to school because I know if you have nobody there to help me, I'm going to help myself for school. If you don't help yourself, nobody go help. Especially high school, you don't experience that point. But college, if you go to college, you got to help yourself. Nobody there to help you. I know my foster mother, she there with me all the time. She said, if you need anything, I can help you. I'm not good on writing. So sometimes I say, Mom, can you help me? Mom, I need this. She there for me. If you don't ask nobody there to know what I need help for. I always ask for help. If I need something, I ask for it. So for the school help you, but you got to help yourself. That's one thing I can say about school.
Thank you, thank you.
Good morning. First of all, my name's Joshua Roselle, and I'm a foster child, but we working on another name, right? So, first thing I wanted to say is the school and education. I feel like that the school I went to didn't teach me nothing. Like, they had like certain levels, and if you got past the level, there was nothing else you could do. Like, if the work was always too easy, and then when if you wanted harder work, they just give you more easy work. So it felt like I wasn't learning anything. So it's kind of hard for me to comprehend some words and understand it. So it's kind of frustrating. So I just wanted to say something about that.
All right. Thank you. The one thing that I'll say, and I'm coming right here, is here and around the country, people always say, nothing about us without us. And so I just want to acknowledge the importance and really my appreciation for you all actually speaking up and talking about your experiences, because this is about your experience. This is about your lives, and so this is really great.
Hello, how you guys doing? I'm Marie. I'm 20 years old. I'm getting ready to age out in like 6 months. I guess the first thing I wanted to touch on was like the school piece. I feel like not enough effort is really put into really letting you figure out what they want to do with their lives. Like, we push college so hard, and it's like, I get it, I understand, you really go to college for the connections anyway, to be honest with you. I mean, you learn some stuff, but 9 times out of 10, you just want to meet people that can help you get to the right place. And so with that, I just feel like maybe we should push just a little bit more on figuring out what exactly the youth wants to do with their life, because there might be other avenues and other things that you can do to help them get to that point. They might be able to make better connections. Like for myself, I'm into fashion, as you can, fashion. So, I like clothes. I want to start my own business. I want to do stuff like that. So it's like, going to school is good for that. But also, like with me, after I came home from my first semester at Morgan State, I started working at Forever 21. And the experience that I got there was just so much more helpful than a whole semester at Morgan State. And I actually got paid to be there and learn all that stuff. So stuff like that is like stuff to think about, because a lot of times like people don't think about that stuff before they just say, oh, go to school, it's free, you have to go. I mean, we know, we get it. I understand that it's free, but I don't want to waste it. That's my whole thing, is that I really don't want to waste it, especially if we all know that money is super tight right now. I don't want to take from somebody else who really might know exactly what they want to do and might need that